This is LiveWell Talk on Concussions. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Concussions are a growing concern among parents of children and youth who play contact sports. Joining us today is Unity Point Clinic pediatrician Luke Spellman to talk more about the signs and symptoms of a concussion and what to do if your child or loved one has a concussion. Welcome.
Thanks for having me.
It's fall. It's football season. So we're going to talk about concussions. Certainly the whole chronic traumatic brain injury and some of the publicity around that has escalated this concern. And so I'd like you to tell me, what is a concussion?
So I think one of the best websites out there and best resources out there is the CDC. And I'm going to give you the direct definition of a concussion from their website. A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. This sudden movement can cause the brain to bounce around or twist in the skull, creating chemical changes in the brain and sometimes stretching and damaging the brain cells. So it's basically a forceful hit that can be to the head, but also to the body that causes abnormal movement of the brain relative to the skull and can affect the metabolism of the brain.
Concussions, we attribute to football as the sport that has concussions, but tell us, are there other sports or activities of daily living that just might yield a concussion in a young person?
Definitely. So, really any sporting event can put you at risk for a concussion. In general, it's pretty much common sense. The more contact you have in an activity, the more at increased risk you are for concussion. But sporting events like football, basketball, baseball, anything where you're in a high movement activity type of sport can put you at risk because you can hit your head in different ways and also, have some contact that occurs, on purpose or not on purpose.
I mean, you can't live in a bubble. You can't put your kid in a bubble. But so I think some people gravitate towards soccer. One, it's increasing in popularity compared to football. But it's not. It's if you will, an urban myth that it's a safe sport in that respect, right? I mean, there's still head injuries occur in soccer.
Yeah, absolutely. It's in a way I consider soccer somewhat of a contact sport. So I've seen a fair amount of concussions in soccer, and actually recently saw a patient that sustained a concussion when she accidentally ran into her goalie in soccer a couple weeks ago. So it's just one of those things. It's the likelihood of a concussion occurring in soccer is probably less, but you still have contact because it's a high intensity sport.
What are the signs and symptoms of a concussion? Sure.
So a really nice resource to look at, and it's available to anybody who has the internet. If you Google the SCAT, SCAT5, that's a resource that we utilize acutely to look at athletes that we're concerned and to help us get an idea if they've sustained a concussion. And really, it's a collection of symptoms, and then there's also some signs too to look for. Depending what resource you use, the SCAT5 has 22 symptoms they look for. So it's I won't name them all here, but it's basically a collection of symptoms to help you focus in and look at an athlete objectively to see if they have concussion. The most common one that we typically talk about is headache, but the SCAT5 also lists some other types of symptoms, including like pressure in the head, neck pain, sensitivity to light, blurring of vision, drowsiness, and a whole array of other symptoms: fatigue, confusion, irritability, sadness. The number of symptoms you can get from a concussion really crosses a huge array of different symptoms. And then when you're looking at signs and you're just objectively, you're looking at an athlete or a child or adult that may have sustained a concussion, looking at to see if the way I sort of put it is to see if they're really there or if they're able to focus, if they look really fatigued. So there's things you can look at and just appreciate when you physically look at the patient.
And describe to us because the reason to be so vigilant about this on the sidelines, if you will, is because of the second impact syndrome. Can you tell us what that is?
Sure. Essentially, this is I would say more of a theory that has really become more of a concern that it does occur. And that's basically once you sustain a concussion, if your brain's not healed, the metabolism of the brain isn't back to normal. If you sustain a second concussion, there's a concern you can have a really debilitating occurrence where there is concerns that there's been some deaths caused. So basically, it's a sustained second hand injury when your brain's not healthy and it's not recovered.
What if you have sustained a concussion, or you think your player has, or your child? When should they go to seek medical care?
Sure. I think that's a really good question, and that can be sort of a difficult question. If you have enough concern and you're worrying about it, the easiest answer is just get them looked at. If there's any sports-related concussion and it's an organized sport, you really are obligated to really now have a medical professional look at the patient and then safely return them to play after symptoms have resolved. If it's like, there's a lot of little kids out there that run around and bump their heads. I think you can use a lot of common sense in this area. So, if they cry right away, they return to their baseline, they're acting themselves after they bump their heads, I think it's safe to watch them. But really, a good general approach is if it's concern, especially in a sporting event, high school level organized sporting event, you really should have them assessed. And if there's something that happens at home and you have increased concern, something just doesn't feel right, you should have them looked at too.
And is the assessment not only a good history and physical exam, but does it always warrant imaging of the brain, a CT scan? So
especially in kids who I generally deal with and young athletes, the push has been not to jump to CT scans quickly. The idea behind that, or the concern, is the amount of radiation they're subjected to. So typically, it really depends patient to patient. And in most cases, for a mild traumatic brain injury, most kids do not actually need a CT. The most important thing is close monitoring and watching for worsening symptoms.
Is it true you shouldn't let them sleep afterwards? I kind of remember that from being young.
So really that was sort of an old wives' tale, I'd say. If you think about, especially a 3-year-old that hits their head, and whether or not they do or don't sustain a concussion, trying to keep them awake all night might be the worst nightmare you could put yourself through. Typically with athletes, for example, like a high school football player that sustains a concussion, really I think close monitoring is the key to make yourself feel more comfortable to give some reassurance. Sometimes I talk to parents about just checking in periodically on them if they go to bed, and then making sure they're appropriately responsive. But the old wives' tale of waking kids up is actually probably contradictory to what they need. They actually need to rest after they have these. So I talk to parents about just periodically checking on them. But if they're comfortably resting, they're appropriately responsive, then I think they can go to bed.
But correct me if I'm wrong. It's not total rest. You don't put them in hibernation. You have to kind of gradually return to play or return to stimulation. Correct?
Right. So acutely, like say after a concussion or what falls into a mild traumatic brain injury, usually within the 24 to 48 hours, their typically recommendation is to take it really easy, to shut things down. The newer recommendations coming out are looking at trying to get kids moving a little more reasonably, getting them up and getting sort of the body and everything working a little bit. But the actual return to play after their symptoms are down, the actual return to play should be a calculated, gradual return to play and safe return to play. Usually, if they're highly symptomatic, the rest period generally, their amount of symptoms generally dictates their rest period. But you definitely, if looking at the newer guidelines, you want to get them up and moving a little bit so they can get back to their normal sort of life.
So if, as a parent, if my student athlete or child sustains a concussion, whether it's an athletic competition or just plain horsing around, and when should I be worried about the post-concussion syndrome? At 3 or 4 weeks, should I be concerned? What amount of time does it take to recover from a concussion? And when should I say, I really need to call Dr. Spellman?
So usually an athlete or a non-athlete, a patient that's sustained a concussion, typically they are seen by a professional and they're being monitored. If they come to me, they basically are having daily or every other day symptom scores, and we're monitoring for that. Really, the return to normal activity and then the return to play varies greatly on concussions, and it really is person to person. Within most cases, a lot of kids are back within a couple weeks, fully back, but it really depends patient to patient. When you run into something like post-concussion syndrome, those are usually, in my experience, like with athletes, kids are out 3 to 4 weeks and are have mentally rested, physically rested, and are still highly symptomatic. So post-concussion syndrome, it isn't a common occurrence, but typically where I start to get worried about that is multiple weeks out where they're doing the right things, they're following the right recommendations, and they're still really symptomatic.
Now, I know my daughters and the college football program I'm affiliated with, we have software impact testing that determines a baseline, and then you retest with the software prior to returning to play, more as a reassurance. Has that influenced the way you practice the software, and how does that help guide? I'm sure it's like a lot of things in medicine. There's just not one holy grail of a test that you can order that tells you everything's okay. It's always a clinical judgment. But what's been your experience with that software?
Sure. There's no one tool out there that is, like you said, the holy grail. But what's nice about, the impact and some of the other neurocognitive tests, computerized tests, is they add a piece to the puzzle, and they add sort of another checkbox to make sure that component, they're meeting their expectations, their scoring on that is appropriate before you really start advancing back. So they're not the only tool we use, but they really capture a component of management that we just can't see with our eyes. We know we can ask their symptoms. We can do an exam. We can balance test them in various ways. But the neurocognitive component is just another tool, just like you said, that is really, really helpful. The best situation is to have a test like an impact before at baseline, and then have one to compare to. But there are some standards that we can utilize if they don't have a pre-impact test before the concussion.
I know this is a tough question, but this is a question I know you've been asked. At what point do you say, okay, that's enough concussions, no more competitive, high risk for head injury athletics?
That is a tough question, and I've been asked that a few times. I don't think there's a number. I think it's a specific number. I think it's really relative to age. I think it's relative. There's a few different factors I look at. I look at age, I look at severity of concussion, and I do look at number in conjunction with those. Really when you get to that point, that's a sit down discussion with the parents and the athlete. And really at that point, if we're talking about that, there's typically a team approach to that. There's a neuropsychologist involved. There's potentially a neurologist involved. And it really depends, really on, like a lot of these, the specific situation, because some people make that decision a little earlier than others. But, I've had kids that have had 2 or 3 concussions have done fine. But I've had families that have decided after the second, third concussion that, this isn't just the right sport. And really, where I've seen a trend is I think people are making good decisions for their individual situations. So it's not a perfect answer, but I'd say it's situation by situation, and it's multifactorial when you make that decision.
Yeah, I bet it is a tough decision. Particularly the pressure that's put on young athletes to perform these days. It is a much more competitive than it ever was, to return to play and not to miss the action. It's always tough, particularly with the high school football season. It's a short season. So you say, well, you got to be out for 4 weeks, whether it's a concussion or any other injury. Well, that's half the season. And the kid, I've found that sometimes our patients, the athlete, tend to minimize symptoms to avoid being taken out of, and that's just not the right thing to do, is it? They should be.
Yeah, I've always, usually part of the discussion, especially if I don't think a young athlete is being honest, I spend part of my time talking specifically about, we really have to be honest about this. And I try to talk to them about long-term, especially adolescents. Kids don't think long-term on anything. So part of the discussion I think it's important to talk about is being honest and thinking long-term. Say 2 or 3 years down the road, we want your brain functioning functionally normal. We want you to be doing okay with school. We want you to be enjoying physical activities that you enjoy. So it really is important, especially if you have that gut feeling that they're not quite being honest with you. But, I would say that the education's really getting out there, because I think coaches are doing a lot better job. The trainers are doing great. And I think parents are really making an effort to get educated on concussions. So that's been really helpful. And that's made, I think, a lot of healthcare professionals' jobs a little easier. And it's been a lot easier to talk to parents and have a good relationship to talk about concussions.
Yeah, and I think the athlete tends to minimize symptoms sometimes. I've had experiences when being the team physician on the sideline that they'll tell me that, no, I didn't lose consciousness. And then you look at the replay and their body's totally limp. Yeah. I mean, they totally lost consciousness. But I don't think they're lying to you. I think they really believe they didn't. So that's why it is a team sport. Football, it's also a team sport to support each other.
Yeah.
What about chronic brain injury? I know you take care of young people, but what are your thoughts on the NFL, the whole chronic traumatic encephalopathy? What are your thoughts?
So I think, I'm not an expert in it, but I think, the NFL finally made a decision to own this up and to take, really the way I see things, when you see a big evolution of things, usually it starts from the top and trickles down the bottom. So looking at college sports, NFL, when they really started taking this stuff seriously, it really helped younger athletes too. Because, younger athletes, that's who they look up to. That's who they want to be. I think what they're doing now, I think they're making, good steps. And I think it's a really serious topic that they're really going to have to study, and they're going to have to watch close, because it's, that there is a connection there. And I think it's going to really change, hopefully in a good way, the way that athletes participate, especially like in the NFL. And I think you'll see too. I think you'll see. You probably won't see as long a careers anymore. I think athletes are getting a lot more educated too, and they're making good decisions.
Yeah, Steve Young, the quarterback for the 49ers, he had that one concussion followed by another one and then retired. And that's prophetic, because he was ahead of his time. And he was kind of criticized at the time of not being tough enough to play in the NFL, et cetera. And now looking back, he probably made the right decision for the right reasons.
Yeah.
Well, this is great information. It's always fun to have Dr. Spellman here and talk sports and injuries related to such, although we pray that our athletes don't have injuries. We hope Dr. Spellman has no business during the football season, and he can just sit around and take care of routine things. Again, this is Dr. Luke Spellman, a pediatrician at Unity Point Clinic Pediatrics. If you have a topic you'd like to suggest for our LiveWell Talk On podcast, shoot us an email at stlukescr@unitypoint.org. And we encourage you to tell your family, friends, neighbors about our podcast. Until next time, be well.